Good morning, everybody. Thank you all so much for being here. We're here today to ask the New York State Department of Health to consider updating the COVID quarantine guidance that is currently in place for congregate care settings, places like group homes. I have received countless emails, phone calls, messages from frustrated families. They cannot understand why their loved one who resides in a group home must repeatedly quarantine for 14 days after an exposure, even though they have been fully vaccinated. Staff are not required to vaccinate, which is fine, it's their right, but they're not even required to test. And as a result, they've unknowingly brought COVID into group homes. The guidance mandates that if a home has a COVID exposure, then they must quarantine for 14 days. Many of these homes have rolling quarantines. They come out of it for a day or two and they go right back into the quarantine. And again, these residents who live in these homes are largely fully vaccinated. Why does this one population, why is it continuously disregarded? If vaccinations are considered effective in protecting the population, so much so that our state has the luxury of being able to claim that they've introduced the vaccine passport to prove immunity, then why are the residents of group homes who have been fully vaccinated not given the same consideration as protected? If I'm vaccinated and I get exposed, I don't have to quarantine for 14 days. Why are the residents in group homes repeatedly who have been exposed, although vaccinated, expected to quarantine? The guidance is out of date, and there's no science that protects this population differently than this. These are, if you're vaccinated and you're protected, you're vaccinated and you're protected. So there's no sense in this. There's certainly no fairness in this. And that's why we're here today. We have a really great group of family members and even one resident who herself has been subject to rolling quarantine. So I'm going to pass it on so that you can hear from them. That's where the real story is.
Thank you, Missy. I appreciate the opportunity, and good morning and welcome everyone. My name is Russell Snaith, and I'm a founding member of the New York Alliance for Developmental Disabilities, NIAD. We have nearly 6,000 members statewide, and we advocate for the rights and well-being of those with developmental disabilities. Missy gave a perfect summary of why we're here, and this is deja vu 2020 to me in terms of excessive restrictions that are lagging behind, not based on science, common sense, and start to become discriminatory and neglectful. I think the point around the residents in the group homes being vaccinated with a number of vaccines that have a 94 and 95% efficacy rate, and by virtue of being vaccinated, you have to ask yourself, what is the risk? We can't force or mandate staff members or other folks in society, let's say at large, to be vaccinated. That's going to be a personal decision at some point. And there's always, in the new world going forward, going to be a certain degree or percentage of individuals who are just not vaccinated. People don't get flu shots. People won't get COVID vaccines. So there'll always be some degree of positivity and transmission out there. But we'll go to herd immunity and the numbers will go way down. And these individuals in the group homes are essentially protected. So they either are protected or not. Positive staff should be removed until well, and group home residents should have no restrictions. And, not to repeat Missy's comments about the setup for this, but I think the point here is around quarantining these individuals and, once again, excessive restrictions. And when I think of the word quarantining here, I kind of think about the history and the litany of kind of forgetfulness and neglect of this population last year in the New York Unpause planning and the reopening. They were forgotten about. They were neglected. And as a parent of a young man who's 25 years old and lives in a group home in New York State, he's personally been subjected to these restrictions. These are restrictions that start to affect your emotional well-being, mental demeanor, and outlook that then lead to self-injurious behavior, aggression, and physical injuries and hospitalization. So once again, the quarantining, the isolation, and the restrictions are going to have these mental effects that turn into physical. Not to mention the fact that in my son's particular case, medical appointments are being skipped and deferred for tests and medical treatment that is seriously needed to prevent bigger problems and to protect his well-being. So when I think of the word quarantine here, again, being in play, I think of this, it's kind of a metaphor for me in a lot of ways about how this population has been treated last year and in years before by this state. In effect, they've been quarantined from society, even before there was a pandemic. This group has been quarantined and continues to be restricted and forgotten about and overlooked despite a virus. And now that we're in this pandemic, they're including them in quarantines in groups like prisons and detention centers, and the CDC is talking about high rates of turnover. The guidance needs to be brought current. The CDC guidelines, they're not mandates, they're guidelines. They change a lot and they're not always right. First you wear a mask, then you don't wear a mask. First it's transmissible from a countertop, now it's not. So we need to be realistic here and get real in terms of the efficacy of these vaccines and the folks that are vaccinated, and stop the restrictions with them and let them go about their lives freely. So with that said, I'm going to, at this point, I believe, turn it over to NIAID Executive Council Member Sue Havco.
Good morning. I just would like to share briefly about my son. My son is nonverbal. He's been living in a group home for almost 6 years now. He, a couple of months ago, had an additional quarantine put on his house because there was a resident who was positive. So that one is a little bit more understandable. But recently he had another quarantine placed on his house. The house manager called me. She did not inform me of why there was this additional, who was the exposure coming from. And then, so I had to call the service coordinator, who told me that it came from a staff. But then I was never informed after the quarantine was removed. If I wouldn't have asked, and said, are we still in quarantine? Is this still going on? I would not have heard. Now, I do have to say, for his house, he is not relegated just to his bedroom. He is able to move throughout the house, and occasionally they will try to go on an outdoor walk. So, but that quarantine was over mid last week. We as parents are still excluded from his home. There still is the sign up on the door that says visitors are not permitted. I'm just going to tell you, I do not consider myself a visitor. I am essential in my son's life. And it hurts to month after month after month continue to see that sign calling me a visitor on his door. The other thing I'd like to say about my son, during the quarantine, a lot of people do Zoom and FaceTime, and these are not effective methods of communication for my son. So, I mean, we do it here and there, but he is a young man who likes to have personal touch and personal contact and loves to sit with his family. So keeping him quarantined and separated is a pretty high cost to him. It's an emotional and mental toll on him. Additionally, because he can't wear a mask, even when his house is not in quarantine, he is not allowed to go to any stores. We used to and usually go to like big box stores like Home Depot and Lowe's to walk with him when the weather is not good, and he is not allowed to do that. Now, I have called, he doesn't live local to me, and I've called some of my stores, and they are a little bit more understanding. But it's interesting to me that there's no effort made by his house manager or his staff to figure out where in the community he actually could go that they would allow that. In addition, it has started to impact some of his medical tests. He has been refused some medical tests because he can't wear the mask. And, these are things that we need to take into account, that, that they should not be experiencing a lack of medical care. Thank you.
Okay, thank you so much, Susan.
Yes.
Next, we're going to ask Erin to speak about her experience.
Yeah. Hi, everyone. Thank you so much for having us today. We really appreciate all of your support and allyship at these crucial times. As we know, the group homes are required to follow the OPWDD guidelines. That is what needs to be updated. There has not been a revision out from the OPWDD regarding the quarantine mandate since before the vaccine distribution began. My little brother, Tommy, is a gorgeous little kid who is 6'2" and lives in a group home on Long Island and has been fully vaccinated since February. He did not do well during the first lockdown. He was not able to come home with the family or leave his property for over 100 days. The mental stress that this took was horrible and took a huge toll on his health. He regressed in his limited language and then experienced a severe cardiac episode shortly after being released from lockdown. It was definitely one of the most horrific experiences my family has ever been through. We were so grateful to New York State and all of the employees and the politicians that helped us and included the developmentally disabled for being among the first New Yorkers eligible for the vaccine. We signed Tommy up right away. Anything to keep Tommy safer and with access to his loving family and his community, we will always do. His quality of life is incredibly important to us. Since his vaccination, sadly, a temporary staff member was diagnosed with COVID and the whole house went into quarantine. This now meant that my healthy 6'2" brother was forced to stay in his 10 by 10 bedroom all day long, only allowed out for meals alone, not even with his housemates. He doesn't understand the isolation. He doesn't have the mental capacity to understand that. He gets confused and he starts to withdraw. This is just not fair. He's always in movement. He's always walking around. Being confined to a box of a bedroom is basically mental torture. The CDC has updated their guidelines for people who have been fully vaccinated. Most of my family is now fully vaccinated. We do not need to quarantine if we are exposed to someone with COVID. This rule should be the same for people who have developmentally disabilities. The true job of the government is to take care of the most vulnerable in our population. There is no one more vulnerable than the developmentally disabled. They should always be the first thought when making policies and decisions. Sadly, they are consistently an afterthought and try to figure out how to piece and fit them in rather than truly taking care of this vulnerable population. It's easy to forget about those who can't speak, but it is not easy to forget about the loudmouth activists that are always going to be knocking down the door. We need everyone's help. We need the disabled to be held to the same standard as the able-minded population in New York. Please do not quarantine our vaccinated loved ones. Thank you so much.
Thank you so much, Erin. And to what you spoke about, this question of the guidance being, that not updated. Even more salt in the wound is a lot of these families were given guidance, incorrect guidance by their group home when asking, why are we quarantined again? And they were sent a link for the guidance that was for community persons, not for congregate care environments. So that created a whole lot of confusion because they're reading guidance that clearly says they do not need to quarantine, only to be told later, oops, a mistake, that was the wrong guidance. Here's the guidance for congregate care that says, even though you've been vaccinated, you should still quarantine. Why? Where's the science in that? If you're vaccinated, you're vaccinated. No?
So it should work the same way on able-minded and disabled-minded.
Right, exactly. And that's the distinction we're trying to bring forward here. Thank you again. Our next speaker is Jenny Rubino, Tice.
Hi, can you hear me? Hi, everyone. Thank you for letting me speak today. I'm a little nervous because I don't do this, so bear with me. My situation is a little bit different in that For me, the first shutdown, my son was home with me for 6 months because he's verbal and he's I don't want to say easy, but I was able to do it. And it was that or have him live isolated in the dorms and not be able to visit him. And I didn't want to put him through that. So we made the choice to keep him home. And then in September, they opened up for 2 months. And then again in November, they shut down again. The numbers went up and we had to make a choice. So he's been home again for another 5.5 months since then. So he's been home for a year, basically. And he doesn't do remote learning. So he's losing a ton. He's 17 years old. And he's very active and very social. So not being at school has been really not good for him. He's declined a lot in that aspect. But my situation is that the only way they'll let him back in is their rules that they have are, if I get him vaccinated, I have to do the first shot, then wait 21 days, do a second shot, then wait 2 weeks, then he can go back with no restrictions unless someone tests positive, and then we have more quarantining. But then they're also telling me, and it only lasts 3 months. It's 90 days. And then after that, we don't know what's going to happen. So they want me to get my child vaccinated when this is a new vaccine. And I'm a little nervous about it to get started with. But then they're telling me then 90 days later, we don't know what's going to happen. We have to wait and see. So to me, that doesn't give me much confidence to get him vaccinated. The other thing that is, if I don't get him vaccinated, now, thankfully, I can't believe I'm saying this, but he caught COVID. So he's actually, I'm waiting for his quarantine time to be up for now. He's allowed to go back to school because he's had the virus. So now he's considered immune or whatever, but it's still only 3 months. They said he can come back for 3 months, but we don't know what will happen after those 3 months are up. So I'm still dealing with that. But their other answer to it was, he's with me all the time, as I said. So every Sunday I would pick him up every Friday, and then I would return him every Sunday. So their suggestion was, okay, well, every Sunday he needs a COVID test to get back to school. And then he would have to quarantine in his room until the test came back. And then, but for him, he's only there for a week. So if he's quarantined for 2 days, then he's not going to school. He's not doing anything. He's in his room. So they really have just been, they're saying that they're going by OPWDD guidelines. And I have to tell you, I have notes from about 5 different people that I know that each child in Devereux, in this particular school, has had a situation, and they have told the parents something completely different than what they've told me or what they've told this other person. And it always goes back to, oh, well, we're following OPWDD. No, they're not. It's not true. I know it's not true because I've looked up as much as I possibly can. I've been doing as much research as I can. So they're just using, they tell you whatever they have to tell you just to keep you quiet and to do what they want to do, basically. So that's where my struggle is with my child in this particular, they're doing it again. They did it for 6 months and here we are again. So I'm actually happy he caught COVID, which is crazy.
Thank you so much. Thank you.
So that's my thing.
Next, we're going to hear from Suzanne Reek.
Hi, everyone. My name is Suzanne Reek. I'm the Executive Director of the Nassau Suffolk Chapter of the Autism Society on Long Island, over 4,000 families. I'm a member of NIAD, and I'm also the parent to a 21-year-old son who's nonverbal, lives in a group home in Missy's district, and he has been fully vaccinated. So I really don't understand why our children are also being treated less than the rights of prisoners. This has been during the whole pandemic. I feel that our children have just been forgotten. They've been overlooked. And where is Kastner with OPWDD? I'd like to hear him come out and make a statement about why our children have to adhere to a higher standard than the general public, and even, as I said, prisoners in in a jail. So I really feel that these children have the potential, including my son after being fully vaccinated, to perpetually being stuck in a 10 by 12 room and not being able to have any quality of life and having his mental health be affected. So I just don't understand the reasoning why that they have a different standard to adhere to, and who's going to protect them. I mean, why have they been forgotten? My son, for 4 months, we were not able to see him, and now we have the potential again to have this happen because the staff, that they don't have to have any guidelines about being tested. At least 9 staff members in my son's house had COVID, and there's no guidelines for the testing for them for coming into work. I understand it's their right not to be vaccinated, but yet my son also has his right to be safe and to be part of the community. Part of the Autism Society's mission is to make sure that our families and our individuals with disabilities are fully participating members of the community, and their rights are been violated. And I'd like to know why. And where is Kastner? Where is he with this? And that's really what's important to me, is just to protect the rights of my son and everybody else on Long Island and in New York State, that they should have that right not to be perpetually on lockdown and on quarantine.
Exactly. Thank you so much, Suzanne. I have to read, I'm sure you guys can all see in the comments, in the chat section, Lynn Amile posted, a comment that said, "I did not park my son's civil rights at the door when he became a resident." And that's exactly true. It's just crazy. Okay, next we have Carol Dreyer.
Yes, hi. My son is 23, and he is in the same group home as Jenny's. Since last year, it's been extremely stressful on our family and my son Daniel. Last year, he was home for a visit, and at that time, the shutdown was starting, and we didn't know whether to bring him back to Deborah or keep him home. He has aggression, so he cannot be home with us long. But because we didn't know when we would see him again, we decided to keep him home for like 4 months. And until it got to a point, he became so violent, we didn't have a choice but to bring him back. And with that, we didn't know when we were going to see him again. So about 2 weeks ago, he finally was vaccinated with Johnson & Johnson. So I have no idea what's going to happen if someone in his dorm has COVID, staff or a resident. And that's unnerving because when he's quarantined, they're required to stay in their bedroom. And if they want to come out of their bedroom, they have to wear a mask. He won't do either of that. So they make a makeshift bedroom in one of the conference rooms in the business area. And they set that up for him so he could roam around a little bit more. But he still doesn't like that. And he's in that room for like 10 days. So it's been hard. And the guidelines and the protocols do keep changing. And that's been stressful on us a lot, with not knowing what to expect, when we'll see him again, and like it was said, Daniel will not do Zoom. So we can't see him. It's just talking to him at night. So it's really, really stressful for us.
Thank you. We understand, believe me. And, you brought up a good point. Your son's home, they have to quarantine in their rooms. That is directly harmful. I mean, for our kids who, many don't even understand why they're being kept away from their families, but being kept in their rooms with no socialization, no outings, they've already suffered over the past year from excessive restrictions and actually no plan B for how to get them out again, how to socialize them, how to reintegrate them back into their routines. And now these rolling quarantines are just shutting them in more and more again. And it's the rest of the state, the rest of, is emerging and going back out, except our kids and our siblings and our loved ones. It's just unconscionable. Thank you very much.
You're welcome. Thank you.
And I think the last person we want to hear from is Robin. And Robin has a unique perspective because she actually lives in a group home, and she can tell us firsthand what this feels like. So we're very excited to hear from Robin, always. You have to unmute yourself, Robin.
Okay. All right, I got it. There we go. Hi, everybody. Good morning. How are you guys doing? I want to say right now, I'm actually back to quarantine again. Can't get out of the house. I can normally go downstairs and eat breakfast or go in the backyard. As of yesterday, they wanted me to wear a mask around my housemates. And I said, no, I'm not wearing no mask. What are you talking about? I said, nobody said I had to wear a mask up until yesterday. I started crying. I just couldn't deal with it. And I said, I understand you want me to be safe, but it's not right for me to wear a mask if nobody's telling me to wear a mask. My nurse didn't say it, so I'm not going to wear no mask. So I basically just said that this is not right. I mean, I'm quarantined because somebody I know just got tested positive for COVID, which is the truth, and I'm negative. And the truth is that why people in group home need to be in lockdown when we're tested negative, we should be able to go out. And people who are tested positive should stay in the house. I don't understand why we are in group homes that have to be tested negative to stay in the house for 10 or 14 days and can't do nothing. And yes, I know you're trying to protect me, but I'm wearing a mask, I'm fully vaccinated, and they're telling me I'm still stuck in this house. That's unacceptable, and I find that they should let the group homes or people that are positive go out and enjoy their life and expand what they have to do, program, work, what I can't even go to work, whatever the situation is. Then also the people that are positive, they should stay home and get better. Not the people that are negative. If it comes back negative, okay, that's a different story. But I've been positive, sorry, I said the wrong name, negative twice. And I already went for a COVID test. And I just don't understand why I'm stuck in the house again. It's a beautiful day outside. We all should be get out. I can't even get out except go in the backyard. I mean, I can't even go places. I can't even go to the bank. I can't even go out to see my fiance. I can't go out to dinner with my lunch, dinner, whatever. I can't even see my fiance. I can't even see anybody. It's unuseful. It's just like like they're using us to stay in the house because we're to be safe. I don't think so. There's other ways to be safe. I just personally think that they should change these rules and have the people be more think twice before you say something. I mean, or think twice before you put it into a sentence, and don't mess up the wording wrong, because OPWDD need to fix what they're doing, because I don't appreciate staying in his house. And I'm not even sick. I'm fine. I'd rather be out, and I'm negative.
Thank you, Robin,
You're welcome.
very much for sharing your story, and we wish you continued best and continued health. With that, there's one, Mary, before we take your question, there's one other individual popped up raising his hands, Bob Carpenter. Bob, are you there? And if so, can we unmute Bob?
Hi, can you hear me?
We can.
Hi, I have to apologize. I didn't raise my hand. I may have misclicked. I'm here as a spectator today, and I would like to say while I'm here, I'm very proud of all of our members from NIAD, and a special thanks and appreciation to Missy Miller for putting this together for us. So with that, I'm going to stop talking and let you guys proceed. So thanks very much.
Thank you, Bob. With that, Missy will go and move to questions if that's okay with you. Mary, if we could unmute Mary Rachel, please.
Hi, can you guys hear me okay?
We can.
Assemblywoman, this question can be directed at you or anyone who really wants to answer this. I am in Syracuse representing the station CNY Central. Nice to be with you today. Just looking to get your thoughts on who is really responsible at the state level for revising these guidelines that you all are talking about today. I reached out to the State Department of Health. They referred me directly to the Office for People with Developmental Disabilities. Is that something that is, what's your reaction to that? Because I did ask, the Department of Health is cited several times in the release and in the calls for revision of these quarantine protocols today.
I'd like to welcome you to our world where DOH says, oh, it's OPWDD, and OPWDD says, oh, no, it's DOH. So that's how we feel. And that's the answers that we're getting. I reached out directly to OPWDD when I started getting these phone calls and these emails because I was horrified, especially with homes giving the incorrect guidance, incorrect OPWDD guidance. And then, to have to go back, oh, well, that was a mistake. And it's DOH who is really going off of the CDC guidance. So now they're trying to shift it onto CDC guidance. When I questioned, well, how is it that the guidance for a congregate care environment is different than community persons when both are vaccinated? If you're vaccinated, you are vaccinated. Are you not protected? Is that not what we're trying to say when we have things like a vaccine passport that allows you admission into sports venues or entertainment or movies that is saying we are protected because we're vaccinated? Why is that not the same for a resident in a group home? If they're vaccinated, they're vaccinated. The answer I received from OPWDD was, can you reach out to Department of Health? Because they are who needs to change this guidance. I did reach out to Department of Health. I mailed the letter, played a little phone tag. As you know, Department of Health is down a few staff members. So we, I have called, and we're supposed to speak again this week. Maybe I'll get an answer to that question. They did email me to acknowledge receipt of my letter requesting the change in guidance. So let's see if I get an answer from them when I speak to them this week. Usually it's more platitudes. We're going off CDC guidance. We understand, we're working on it, but I will let you know.
Well, we did see as a follow-up to that, we did see the Department of Health revise a few times in the last few months the overarching guidelines for nursing home, testing of staff, testing of residents, and then the latest has kind of repealed the quarantine process with one case. That 2-week rule shuts down all visitation.
Right.
Why do you think there's a discrepancy between what nursing homes can do, and that's all across the board, and what group homes can do, and that seems to be a mixed message.
I think, well, the discrepancy is what we've been saying for a year now. This population is an afterthought. We are the top of the list if they're talking about cuts in funding, and we're the bottom of the list if it talks about rights and, you know, programs and reemergence. We are an afterthought. They weren't included in any of the phases for reopening. You know, it's a maybe because it's a difficult population to make sure that you're addressing all of the very complex different needs within our groups, but that doesn't mean just do them last. It doesn't mean just discard them and let everything else open and then figure them out. It's a violation of our rights.
Thank you very much.
My pleasure.
Thanks, Mary. Any other, I know we have a couple of hands raised, but I just want to make sure that we give reporters and stations across the state that are on the opportunity to ask questions if you have them. If you do have any questions for the Assemblywoman or any of the participants, if you could please press the raise hand function at the bottom. And we'll give just a second to make sure that you can do that if you do have a question. While we're waiting on that, I know, Russell, you had your hand raised.
Yeah, Nick, just to add to what Missy was saying, I would label this abject discrimination. And I'd like somebody to be able to answer me if the efficacy of the vaccines are any less effective in the developmentally disabled population than the general population. Do the numbers of 94 and 95% still hold for that population? This population has been repeatedly discriminated against, forgotten about, and marginalized, as Missy said, and the first to be cut. So I don't see any science in the CDC guidelines at this point for folks who have been vaccinated where they have further risk. And I think that OPWDD, and I had a personal conversation with OPWDD myself last week, effectively really hasn't changed their posture or guidance going back to last March of 2020 around the need to quarantine. So, you know, and then they will basically kind of, you know, look toward or pass the buck to the Department of Health and CDC. So this is one of these things of who's on first and a game of deflection when we really need OPWDD to stand up and take a position and advocate for what is logically and scientifically correct here.
Thank you. We'll take the next question. If we could unmute Andrea from CBS New York.
Hi, good morning. Thank you. I had two questions, one for Robin. I was just wondering, Robin, where you live and how long you've lived there. And then just for the Assemblywoman or just the group, and forgive me for not knowing this, but what were the protocols prior, I guess, to the vaccine? Were residents allowed visitation and what were the protocols prior? Thank you. Thank you, guys.
Thank you. Why don't we go ahead and we'll start with Robin. If you could let Andrea know how long, where you live and how long you've lived there.
I live in Seaford, New York, on Long Island, and it's now 2 to 3 years, I believe it is. And I do have to just say one thing also. What that person was saying when I was talking before everybody else started talking, I really think that it's almost like a baseball, like first, second, third, and home. That's what I feel like. It's like a baseball field. And I feel like we have choices. I feel like we have our own choices. We signed a paper that we get to do what we want to do. We have choices. We have rights. And I feel like our rights are being taken away by sitting home and doing nothing all day, while we should be able to explore and get out of the house. And since we're totally vaccinated, I think that we all who are negative should get out and don't have to sit home.
Thank you, Robin. And Missy, do you want to take the second part of that question?
Sure. What was the second part?
The second part was just up till now, I know in terms of quarantining and everything, what were the protocols in terms of people who live in the group homes being able to leave or not? And
it's been very spotty. OPWDD is very good at giving guidance that allows individual homes to interpret as it fits them, and in a way that's good, because we have different types of individuals at different homes with different needs, but on the other hand, it kind of sets it up so that one home can have this policy and in place, and the home across the street can have a different policy in place. So there have been homes that have allowed family visitation, outside only with masks worn. They were getting better because of our pushback. I think they were getting better at allowing more outings and visitations. But when the numbers started going up again, then we started seeing a cutback of those allowances, and more of, if somebody was positive, it was just boom, automatically quarantine. You have to quarantine. So, and the fact that they don't mandate that staff get tested, I think is a huge, elephant in the room. That's something that has to be addressed. It was something addressed with the nursing homes. It's something that needs to be addressed, certainly, especially when most of the residents in these environments have been vaccinated. Did that answer your question?
it did. Thank you very much.
Could I answer as well that question?
Susan, if you could just give us a second, I'm sorry. We are very tight on time. The Assemblywoman has another committee meeting at noon that she needs to attend, and I want to make sure that we answer all questions that come up, so I apologize. If we could unmute Mary Keeler from CNY Central again, she has a question.
Just had one other follow-up question for the Assemblywoman. There's one thing that comes to my mind, I guess, and our team discussed this morning, was with these group homes, are there doctors that are traveling throughout the state to different group homes, different areas? Is that a concern of how maybe COVID is getting in and possibly, contributing to maybe that rolling quarantine situation? Is that where a mandate needs to happen, where those providers coming in? I don't know.
My knowledge, I don't think it's the providers. I think the positives have been coming in from staff. So from what the families are reporting to me, from what I've been hearing, it has been a staff member. So I don't think that it has anything to do with doctors. I think, there should be some requirement for testing for the people who are not vaccinated and people who are, residents or regulars. If you're going into that home, if you're working in that home, then there should be some testing requirements if you're not vaccinated, and there isn't. And so we're going to keep exposing, as long as there's some COVID out there and people are circulating, if you're not vaccinated or if you're not tested, they're going to keep having these positives in the homes and punishing the residents.
Do you by chance know a ballpark amount of how many group homes the state has?
I don't, but I certainly can get it unless Russell or Bob, they might have a better idea than I do.
I know on Long Island alone, you're looking at over 100. I know we have 80 to 100,000 DSPs in New York State that support those. So it's certainly in the hundreds of group homes. If I could just add in 10 seconds to the point about testing, I had a direct conversation with OPWDD leadership last week where this was the hot white topic around testing of staff. We can't force them to get vaccinated, but we can sure as heck require them to get tested. And if OPWDD has an issue with that, they should at a bare minimum take a very strong, visible posture of a very hearty, strong suggestion and recommendation to get tested, which I'm not seeing from them. short of a recommendation. They said that they certainly should be requiring testing because that's the only way to trap positives, protect the staff from each other, and mitigate that situation, because the residents are protected with the vaccine. But if the staff gets infected, then that becomes a staffing and an operational issue and a potential health issue for these staff members. So testing is the white elephant, and it's the blinding flash of the obvious. Let's get the staff tested.
Thanks to you both.
And Mary, I'll see if I can get a more accurate number for you of the number of group homes in the state. I know we have, Jenny, I know you have your hand raised. We do have to keep things, Missy's got a jet very quickly, so we can go ahead and unmute you, but I want to make sure that we have enough closing time for Missy as well.
Okay, thank you. I appreciate that. I just want to follow up with what Missy was saying about how OPWDD has guidance. And what's happening is each agency is allowed to do whatever they want. So the agencies that are being more strict those are the ones where the residents are suffering. So like, is there any way to make it a global thing, or is that, I don't know who could answer that.
I have asked repeatedly because these discrepancies, in how an agency interprets the guidance is unfair. It's unfair if you have a friend whose, son lives in this group home and they're doing this and they're going there and yours isn't. And I've asked repeatedly, and it's been a problem even before COVID that, some of these guidance are interpreted differently by different homes. And their answer has routinely been that they cannot mandate certain things. They can't mandate that a home does this, but they certainly have no problem mandating that they quarantine or that they, so it's a very questionable response, honestly. So something I'll continue to ask them.
Okay, thank you.
Thank you.
If I could just add to that real quickly, OPWDD provides guidance. That's the minimum standard. They say that the agencies can provide more conservative or, cautionary or safe measures. But OPWDD is supposed to be the governing oversight body that also ensures, reasonableness, fairness, and keyword consistency. So we see a lot of variation and consistency across the state, which these families represent, and creates a lot of angst and noise to people like Missy and I in terms of the inconsistencies. And it's the standard deviation and variation is too much. And OPWDD doesn't really step in and control that. The guidelines they put out are the minimum, but agencies are free to really run on their own and set much more stringent and sometimes unreasonable, unfair standards.
And what Russell and I each, what we have said routinely to them is, you are there to be our protectors. We turn to you to make sure our best interests are being taken care of, that their rights are protected. And that's not what it feels like when we feel like the rights are being violated instead. So it's an issue that we just will keep pushing. And so I guess we're going to wrap it up, Nick.
Yep. So with that, I just any press that's on the call, if you have any follow-up, need any video, have any other questions, please reach out to me directly. I'll happily get you what you need. And thank you all for joining us today. Missy, over to you.
I just want to thank everybody. Thank you again for always reaching out to me, letting me know what's going on. I'm pretty intimately involved on a day-to-day basis with this, this world, but I don't know what I don't know, which is, if you have a child in a group home or a sibling in a group home, those are things I don't know. And that's the whole point. People don't know what they don't know. And unfortunately, it seems to me a lot of times, like the people who are making these policy decisions and these mandates, they don't know what the real situation is. And without you guys, I wouldn't be able to inform the public, and let's try and make some change. So I do thank you. And if anybody else has any questions or anything, please reach out to me.